Good morning students. Welcome to physical education class. In the previous class we discussed about disorder and disability. Today we will know what is the causes of disability. Disability may be present at birth or acquired later in life. Some prominent causes of disability are: first is genetic. Specific genetic and chromosomal conditions such as Down syndrome and phenylketonuria are well-known causes of disability. This results from abnormalities of genes inherited from parents, errors when genes combine, or from other disorder of the genes caused during pregnancy by infections, overexposure to X-rays and other factors. Next is poverty. Poverty leads to an increased risk of malnutrition and childhood diseases. Poverty causes children to grow up in disadvantaged positions. Lack of food, stimulating environment, and inadequate health care all contribute to enhanced disability. Next, accidents. Road accidents, workplace accidents, natural disasters are all causes of disability. Sports accidents, as in skiing or car or motorcycle racing, may causes permanent disability. Next is malnutrition. Malnutrition leads to both mental and physical disabilities. Less the nutrition in food, more likely it is that health issue will occur. Malnutrition often leads to poor growth, being underweight, bad skin and teeth, muscle weakness, learning disability and fragile bones. Also present will be learning disabilities and poor attention span. Low immunity leads to frequent and debilitating sickness. Next is environment. Many chemicals in our environment cause damage to the central nervous system, which can lead to developmental disabilities. The environmental impacts development of intellect and thus leads to autism and linked disorders. Next, diseases. Long-term diseases often arise from diseases such as diabetes, cancer and heart problem. Limitation in day-to-day activities and functioning of the body part affects a person's mental diseases like depression and schizophrenia also contribute to human disabilities. Next is healthcare. Improper or ultimately medical help may cause long-term or even permanent disability. Proper care at the time of delivery of newborn can prevent a lot of conditions such as cerebral palsy or even autism and birth fractures. Proper immunization also helps in preventing many debilitating diseases like we have done in the case of polio, a disease that was once a leading cause of disability in India. Timely treatment of injuries lead to complete recovery and can prevent a lot of disabilities. Next is lack of education. It is an indirect cause of disability. Ignorance causes people to underestimate the severity of their illness until it ends in permanent damage and disability. Ignorance prevents timely attention to sickness as well as lack of precautions. Ignorance increases dependence on non-specific treatments and the result is disability. Next is disability etiquettes. What is disability etiquettes? Disability etiquettes is a set of guidelines to deal with the people facing physical or mental disability. Okay? The term serves to communicate people with disabilities more respectfully in all types of situations. It involves treating people with disabilities with respect and care and try to bring them into a normal life. Next is disability etiquettes in general. Always respect the dignity of a disabled person. Individuality and desire for independence. Treat a person with disability in the same manner and with the same respect and courtesy as with others. Speak directly to the person rather than through the friend, attendant or sign language interpreter who may also be present. Never speak about the person as if they are invisible, can't understand what is being said. Don't put people with a disability on a pedestal or talk to them in demanding terms. Next, disability etiquette guidelines. First is wheelchair etiquette. Do not patronize people who use wheelchairs by patting them on the head. Do not lean or hang on someone's wheelchair. Ask for permission before touching someone's wheelchair. Do not stand over them for too long. Place yourself at the wheelchair user's eye level. Next is visual disability etiquette. Give clear directions including obstruction, if any. Do not hold the arm of a person with vision impairment in order to guide them. Allow a person with vision impairment to take your arm guide rather than push or lead the person. Use specifics such as go 100 feet to the left or 20 steps to the right. Always introduce yourself before starting the conversation. Okay. Next, hearing disability etiquette. Do not shout. Make sure there is no background noise or loud conversation behind. Tap the person on the shoulder or wave your hand. Look directly at the person and speak clearly and slow to allow the person to read your lips. Not everyone with hearing impairments can lip read. Face a light source and keep your hands and foot away from your mouth when speaking. Written notes may also help. Next, learning disability etiquettes. Speak very slowly and politely. Use small words and sentences. Use illustration to communicate. Listen very carefully and attentively to what they want to convey. Okay. Next is speech disability etiquettes. Do not speak fast or rush such a person. Do not pretend to understand what they are saying. Allow them to repeat. Let them complete what they want to say. Do not complete it for them. Do not correct them. Instead, encourage them. Okay? That's all for today. Next day, we will know what is the types of disability. Okay? Thank you.